Good afternoon. Well, welcome to the latest media conference here from government officers. Slight change of tack today in that we're actually going to be asking questions from you, the public. It's a coronavirus Q&A effectively, and we're going to table to the ministers and the health officials of the day the questions you'd like to put to them. Our aim is to put your concerns, your queries to the people who are making the decisions about your health and your life right now. Now, this afternoon, we've been joined by the Health and Social Care Minister David Ashford. We have a number of callers waiting on the line as well, and we will come to them in a few moments. But the first question, I'm just going to ask Mr. Ashford to join us because we've also had a number of questions submitted. So Minister, if I can ask you to come in a moment. And the first question is about testing at Nobles Hospital, and is everyone at Nobles being tested regularly?
Well, thank you very much, James, and it's a very, very good question to ask. In relation to Nobles Hospital, we have been testing all admissions to Nobles for quite a period of time now. So anyone who's being admitted into the hospital is being tested. We aren't testing people who've gone through the med service, so the emergency doctor's service, but anyone who's come into the main hospital itself, yes, they are being tested, and they are actually confirmed in our testing figures daily.
Thank you, Minister. Well, we're going to go to our first question now from the Manx public, and our first listener, viewer, if you like, reader, is Frank Shungle from Douglas. Frank.
Good afternoon, Frank.
Thanks for the opportunity. I think that's a really great idea. Hi, David.
Hello.
Long time no see. I think my first question would be, how do you see the reopening of the borders playing out? I think that is probably the biggest question on anyone's mind. How can we possibly open the borders when the UK is still acting, what many of us would probably call irresponsibly and quite, strangely over there? I mean, it's craziness over there, right? How are we ever going to handle opening our borders again?
The borders is going to be a very slow process. I think I've said previously that the borders is the last thing we'll be looking at. What we need to do is focus on what we can do internally. But as you rightly say, the whole issue with the borders isn't about what's going on the island so much. It's around what's happening around us, particularly in our near neighbours, the Republic of Ireland and the UK. So as with a lot of these decisions, the borders will probably have to be on a phased approach. But it certainly, with the current situation, isn't going to be anytime soon. Personally, I feel the control of our borders has been one of our most effective measures in the fight against COVID-19, and it certainly will be one of the last measures released. So it will not be done so until we can see an improving situation from our near neighbours, not just the situation that's here on Ireland.
So it's big. It depends to a large degree on what's happening in the UK, basically.
Most definitely, and also, like I say, the other side as well. We must never forget about Ireland as well, but it most definitely depends upon what's happening elsewhere.
Cool.
Thank you very much, Frank. Now, another question from the floor, and it regards social distancing. A number of people, as we speak over the last few days, the police have attended a number of calls of people effectively flouting the rules, abusing the rules. What more messages could government give out to these people? Because clearly it's not reaching everyone.
Thank you, James. And I was very disappointed to hear the reports myself of what the police have said they've had to deal with over the last few days. The messages from government, I think, are really, really clear on this, that we need people to act responsibly. The two biggest weapons in our personal armour in relation to fighting this disease are social distancing and continuous hand washing. Now, I need to emphasise again, because I know the police have said that a lot of it has been young people they've had to break up. Youth is no defence against this disease. We have seen cases in the UK and further afield where young people have been seriously affected by this disease and in fact tragically have lost their lives. Thankfully on Ireland we have not had any young people affected to that extent, but that really does not mean you are immune, and I need to get that message across again and again and again. No matter what your age, whether you have underlying health conditions or not, it is a virus, and how it interacts with your system you do not know until you have it. So I really need to emphasise again that people do need to practice the social distancing, and they do need to have the hand washing. I know there's been a lot of pent-up frustration in the community. We've been through 7 weeks of various phases of lockdown, people not seeing their friends, not seeing their families, but it is essential that we continue, for the sake of everyone in our community, to act responsibly. As government moves forward, we have to allow people to make their own decisions. Government can't dictate, we can't manage every part of people's lives. We need people to take responsibility for their actions and do what's right for them and the wider community.
Thank you, Minister. Well, we'll head to the south of the island now, and we're joined by, from Colby, not quite the deep south, but Charlie Omar. Charles.
Hi, James. Thank you.
Good afternoon, Charlie.
Hi, I'm Minister. Are you okay?
I'm very well.
Great. Well, my first question is all about the testing. You'll probably get loads of questions on testing and data. So the charts that you came up with many weeks ago showing the modelling assumptions for the uncontrolled progression, the JHSC's planned assumptions and the optimistic curve, they all showed us a peak and then a gradual decrease, which eventually led back to 0 cases. So we could all see the light at the end of the tunnel, visually see it and have a goal. And then due to most industries being closed down and the social distancing being adhered to, we found ourselves way under what any of the models had shown, which is brilliant. But then, on the other hand, we can't see any potential end to this now, with 1 or 2 cases coming up a day. So have you developed new models? And if so, have you come up with a new end date for this sort of thing?
Firstly, with the initial modelling, which you quite rightly you understand absolutely perfectly about the different curves and the way it was leading out. Just to clarify, that line that goes along the bottom isn't a 0 on any of those models. It is low level transmission, so 1 or 2 cases, but obviously with the size of the graph, it's not particularly easy to see that. I mean, COVID-19 is a virus. People ask me all the time about eradication. Well, the only way you will ever properly do that is via vaccine. So until one is available, we are not going to eradicate COVID-19. There will always be the odd case here and there. The modelling was at a point of time where we needed to plan out what our capacity was within the health service, because that's what a lot of the measures have been about, not necessarily stopping the virus, because we recognise that with any virus, without a vaccine, there's always going to be the odd case here and there. But what it was ensuring is we didn't end up with those dreadful scenes we saw on the TV from places like Italy, where the services were just overwhelmed. So we have, limited ICU capacity, and that's what that modelling did. If we had followed along that blue line on the chart, that was an Italy projection for us, where before we even hit the peak, our ICU capacity and our hospital would have been absolutely collapsing due to the sheer volume of patients coming through. And that was what the modelling was designed to do. We, through the measures we've taken, have managed to suppress the virus, and we are, as I know some people have referred to, bumbling along the bottom, which has given us the ability then to take other decisions, such as opening non-essential retail, the announcements the Chief Minister was able to make yesterday as well, and that's allowed us to progress. So in terms of the modelling, it was great for a point in time, but to be realistic, there's no point in modelling now. Because we are in a different situation. We are into the live data now. Couple of months in, we know how many cases we have. So what matters now is looking at the real data, that whenever we make any changes, those changes can take about 8 days to feed into the actual case numbers, that we see what actual difference to the real live cases those changes make. That's what's important now. So the modelling graphs, basically, they served a great purpose at the start, but one of the reasons people don't hear me referring to them quite as much now is they're not as relevant today when we look at the changes going forward.
Okay, thank you.
Thank you, Charlie. And just for our next question, actually, from the floor, if you like, I know Charlie threw football decades ago, so this is probably an apt time to ask about sports. There's a lot of assumption at the moment that people can resume sports full on, as it were. Take football, for example. You can have 10 people playing 5-a-side. It doesn't quite mean that, or does it? I think some clarification, Minister, would be most helpful.
Thank you, James. Obviously, there are still sports that people can't do and undertake. In relation to, let's use the football example, and my favourite sport as well as an example, which is rugby. Rugby is very much an interaction sport. The social distancing does apply. So if you've got people passing a ball backwards and forwards at a safe distance, they would be compliant with the rules. If you've got them interacting in a full football match, that's not compliant because social distancing can't take place. Like I say, at the moment, we've now hit the tipping point where with the decisions and also unwinding things, we need to rely on the public to use their common sense and do what they believe is right. Sport particularly around this. So anything that involves physical interaction between two parties at less than 2 metres is not available at this time. That's why we've had all the rules previously around golf, which I know some people are finding frustrating, but we have to relax things in a gradual manner, and sport is no different to that.
Thank you, Minister, and thank you for that question. We'll head up north now. I can see Caroline Smith in Selby. Caroline, please ask your question to the Minister.
Good afternoon, Caroline.
Good afternoon, Mr. Ashford. My question is, how long do you think that it is acceptable to enforce children to perform social distancing at school and nursery without it affecting their future mental health, relationships, and developing immune systems?
In terms of social distancing in schools, it's incredibly complex to enforce, to be perfectly frank. There's stuff that can be done within the classrooms. We're allowing children to be so far apart. But, you know, it's not sustainable in the long term. We recognise that. So what we need to do is bring schools back in a phased approach. We are in a very lucky situation on the island with the low number of cases that we can look at various things. But you are not going to be able to stop children playing together. You know, while you can limit the interaction in the classroom, you're not going to be able to limit all of the other interactions. It's just not feasible with young children. So there is a recognition around that. And in fact, that's what's led in the UK to a lot of the debates about schools coming back at all. Although obviously they're in a very, very different situation in terms of the spread of the virus. So no, it's not going to be able to be a long-term thing. And we do at some point have to get the schools back to complete normal. So it's about a phased approach of reopening the schools, and the Minister for Education will be putting more detail on that at the press briefing on Monday. But yeah, there is a full recognition that with young children, you can't treat them the same as you and me. That's not physically possible.
Thank you.
Thank you, Caroline, as well, for your question. Just while we're on that subject, Minister, if I may, and again, the Education Minister is not with us this afternoon, so let me ask you this. In terms of schooling, when the schools reopen in mid-June, albeit in stages, what do you expect? It's optional, of course. What do you expect that the take-up to be? And do you believe there will be parents who, of course, who are reluctant to send their children to school, who perhaps have no choice to, given their career?
As with any of the decisions we take, there will be a nervousness. I fully accept that. Every announcement we make makes someone nervous, and schools will be one of those. I think the reassurance we can give is as the virus has moved on, we've learnt more and more about the virus, and the scientific community has updated its information. One of the things that was focused on early in the pandemic, and many people will remember these headlines across the Daily Mail, the Daily Express and other newspapers, of children being mass spreaders of the virus. As the virus has moved along, that scientific evidence has changed. And in fact, actually, I was funnily enough speaking to the Minister of Education this morning about a recent scientific report that actually says children are half as likely, even if they've got the virus, to pass it on to someone else as an adult. So there will be people nervous out there. That is precisely why we've gone down the route of recognising the fact that people don't have to send their children into school if they don't want to. There's not going to be any enforcement around that. There are people who in certain industries are having to return to work, and so therefore will have to make difficult decisions around that. But we have also within the regulations allowed for family childcare to take place. So anyone and their family who feels comfortable about doing that element rather than sending children into school can take that up as well. So we have tried to open up the options there. It will be a very phased approach with the school. In terms of take-up, it's a bit like putting my finger in the air and trying to pluck a figure out, because we won't know until we get there, and then we will have to contact the parents and in a managed way see which children wish to return. I don't want to preempt the statements being made by the Minister for Education on Monday, but there'll be more detail around that then.
Thank you again, Minister Ashford. Just while we're talking about children then, a question that's come in from one of our younger viewers, listeners, readers, if you like. Can my grandchild stay overnight? That's what this listener is asking.
With the new regulations in place, obviously the recommendation for anyone going to someone else's household is a maximum of 15 minutes and people to stay 2 metres apart, but it is a recommendation. We made absolutely clear, and the Chief Minister made clear from this podium when we brought that in, that what happens inside people's houses, we cannot police. People have to make the right decisions for them and their family. So if people are comfortable with people being in the house for longer or including overnight, the regulations do not now forbid that in terms of grandchildren staying over. But what is absolutely essential is you make sure that that is the right decision for you, particularly if the grandparents are elderly, because we do know that the elderly are an at-risk group. So we are asking people to make the right decisions. I know that lots of grandparents haven't seen their grandchildren for several months now, and there is a mental health issue that comes with that as well, in not having that family connection. But we do need people to consider, do they believe it's safe for them, and make the right choice. We can't now dictate absolutely everything that happens, and nor would it be right for us to dictate what happens inside a private property.
Thank you, Minister. And I should have said that was from one of our more mature members of the community, not one of our younger members, of course. Let's go back to the capital now, and Paul Telford has the floor. Paul.
Thank you.
Good afternoon, Paul.
Good afternoon, Minister. I think probably the two numbers that people pay most attention to is the number of active cases that we have and the number of new infections. And I think it's possible that we could get to a point with the current trajectory where there are hopefully no active cases and maybe a prolonged period of no new people being shown as positive. If that's the case, people, I think, will start to believe the island is virus-free and will start to question the need for the continued measures that we're taking with social distancing, wearing face masks, etc. How do you intend getting the message across to people that we need to continue with that if we are in that fortunate position of effectively saying there is no more active cases and no new cases arising?
I think the key to that is exactly what we're doing now, which is direct engagement with the public via the press conferences, via things like this, to get that message across. I think I stated a couple of weeks ago in one of the press briefings that there's two danger points. Your first danger point is when the cases are going up and up and up and up, because you need to bring that spread down. Your other danger point is at the other end of the scale, where you end up with the odd one case here, one case there, because precisely as you say, people say, well, there's no real virus on the island, so we can just go back to normal and do what we used to. And so that's a danger point as well. And I know I sometimes sound like the merchant of doom, constantly banging on about the fact that we mustn't be complacent. But as with any virus, it's a hidden enemy. We don't know, how much transmission there is in the community, because we know with COVID-19 there are some people who contract it and they never show any symptoms at all. So there is always that risk. As I say, the only way of eradication is a vaccine programme, but it is important that we actually move in a staged manner. That will frustrate an awful lot of people, but we've got to do what is right for the health and well-being of our island community. We have been able to move, though, a lot faster than many other jurisdictions. You look even at some of the smaller jurisdictions, the changes we've been able to make due to our low case numbers have allowed us to move forward faster, but we've done so in a very careful way, always looking at the data and where that data is going, and that will need to continue. So I am pretty certain when we get to that stage, I will have an awful lot of emails, phone calls telling me we need to move faster, what's the problem? But we do need to do this in a controlled way. And I think the way of getting that message across is exactly via things like we're doing now, of engaging direct with the public and getting the message straight out about why we are doing various things. There will be people who won't disagree, who won't agree with what we're doing, but at least they'll understand why we are saying what we are saying.
Thanks.
Thank you again, Minister. Frank, Caroline, Charlie and Paul, while you're here, by all means, if you want to ask another question each in a few moments' time, you're very welcome to. It seems a shame to waste the opportunity while we've got you dialed up. Just a twofold question, if I may, from another listener, Minister, now. They're not mutually exclusive, but they're connected. In terms of car sharing, can I car share with somebody from outside my household? And secondly, when is the government due to next review the 40 miles per hour speed limit?
Well, taking the last point first, if I may, James, in terms of review, all government policies around the emergency are reviewed on a 2-weekly basis. So every fortnight, every single policy is reviewed. So the 40 mile an hour speed limit will be up in that review period as well. In relation to car sharing from outside of households, we're not quite there with that yet. A car is a very enclosed space. We obviously know, again, if it's over 15 minutes, you're less than 2 metres apart. That is the greatest at-risk category. Though I know taxis are operating at the moment, but taxis have a very stringent cleaning regime put in place with advice from public health as well as to how they need to operate, something that isn't enforceable within a private vehicle and probably not even doable within a private vehicle. So I know there's lots of people, again, absolutely biting at the bit to be able to car share in the way that they used to, but at the moment we're not quite there yet with that. We're not quite willing and comfortable enough to take that final step with that one.
Thank you again. Let's go in reverse order this time then. So Paul, if you've another question for the Minister, please fire away.
Thank you very much. So my second question is really, when would you hope to start allowing the more normal health issues to be looked at? And I understand at the moment the need to keep the hospital available for people who obviously need emergency or serious conditions looked at, but ingrown toenails are still ingrowing and people still need the general inconvenient issues dealt with. What's your sort of timeline towards the more normal healthcare service resuming?
That's an absolutely perfectly timed question, Paul. I want to assure people I didn't pay you to ask this, but actually we're filming this on the Friday because I believe it's going out later in the week. So just to clarify, when I make references to Monday in this, we are actually filming this on the Friday, and at the press conference at 4:00, that is exactly what I am announcing, is round restoration of certain services. And in fact, this wasn't planned, but I have the document with me, the Back to Health document that will be being published later today. One of the issues we have in DHSC is not just turning services back on. I mean, turning them off was simple. It's very easy to turn something off, but a lot of the services are interdependent. So you've got certain services that require another service to be up and running or operating to a certain level. So it's not just a case of turning the service back on. We've got to make sure all the auxiliary services are up and running as well. So what I will be announcing this afternoon, you can have a sneak preview, is that we are going to be doing things in a staged approach. So just as government reviews policies every 2 weeks, DHSC every 2 weeks will be stepping forward with the turning on of new services, of the old services resuming, I should say. So for instance, endoscopy and services around that are going to be announced this afternoon by myself, and we'll be doing it in a staged way. We'll also be able to announce certain things around breast cancer care as well, subject to radiology provision, because we do recognise that during the outbreak a lot of people have been left without those services, particularly cancer patients. But in relation to cancer patients, one of the reasons for that was we know from studies across the world, particularly in Italy, that cancer patients, if they catch COVID-19, their mortality rate is 5 times higher than someone without cancer. So there was very good reasons for stopping those treatments. But the position we are in now, we are able to start redeploying staff back. But as you rightly say, we've got to get that fine balance of ensuring that then doesn't hamper any response we still need to do for COVID-19. So at the moment, I'm a bit like a juggler trying to keep about a dozen plates in the air and without dropping any of them. But we are going to do it in a staged, managed way. And I'll be doing those announcements at 4:00 today. So a very timely question.
And of course, Paul, by the time you are watching this live, loud and lovely, you'll already know the answer as well the public. So thank you, by the way, all of you for your such depth of questioning. We can't ask them all, but certainly, hopefully it provides a balanced flavour of what you're interested in and potentially concerned by. And we will give an email address at the end of this briefing in which you can email questions for potential further conferences as well. Let's go back up north. Caroline, have you a further question?
I'd just like to ask, if children are such low risk, why have they not been allowed to go back to school earlier?
Because the scientific evidence is only now beginning to coalesce around that. As I think I mentioned before, at the start of this, you saw those wonderful newspaper headlines about children are the mass spreaders. And that was the feeling that, you know, as with things like colds and so on, many people felt COVID-19 operated in a similar way. The evidence now is starting to suggest that children don't spread the virus in that same way. They still don't know why. That's quite interesting. None of these reports have managed to actually button down, but they think it's something to do with their immune response within the body to the virus. We had a very interesting case, which I will bore you with, of a child in France that was asymptomatic. He was tested because he'd been into contact with someone else who was COVID positive. He was found himself to be COVID positive, but in the interim, he'd been through 3 different schools. He'd had 172 contact points, but none of those 172 contact points went on to develop the virus. Now, that's a very extreme example, but the level of transmission, certainly the scientific community now is starting to coalesce around the fact that children are much less of a threat as spreaders than we adults are. So the reason is this is a brand new virus, and the scientific evidence has been building over a period of time, and it takes a substantial period of time to get scientists to agree with one another, but they are now forming a consensus.
Thank you. Thank you again for your questions, Caroline. Just while the Minister's here, what would you say if we said to you there are local medics who for some weeks now have felt that in a phased-in introduction, the children, it's been perfectly safe for children to return to school, but the education unions are the obstacle, the hurdle, if you like. What would you say to that?
Well, what I'd say to that, James, is obviously there is concerns out there. We understand that. The unions will be concerned about their members going back. But I think what we need to do is give them the evidence we are working on, the basis on which we are working on, look at where the island is. I don't think it's always wise to compare us to other jurisdictions because particularly in terms of the cases emerging and the virus spread in our near neighbour, the UK, we are in a radically different situation to them. And look at where the risk profile is coming from. We need to work with the unions and reassure them, and I know the Minister for Education has been engaging quite a lot with the unions to be able to give them that confidence that they can then spread with their members. I don't see unions as being an obstacle. I see them as a partner to be able to work with to ensure that we work this up in the best possible way. And I think also the fact that we are going to do a phased approach, which the Minister for Education will again be expanding on at Monday's briefing, but that'll be after this, that'll be before this goes out. I think he'll be able to actually put more meat on the bones there and give that extra reassurance to people that it is a safe environment for people to be able to go back into.
Thank you, Minister. Let us go back to Charlie in Colby. Have you got a further question, Charlie?
Yes, Sam. Okay, yeah, I'm just sticking to the data as well. So my second question is actually on the testing data. This has shown us as being one of the best performing countries in the world. However, I think these comparisons are possibly flawed due to different ways countries report their test data. The number of tests does not always refer to the same way in each country. One difference is that some countries report the number of people tested as opposed to the number of tests. And these number of tests can be a lot higher due to multiple tests or them counting the number of swabs issued, etc. Like the UK's test data is 3 times higher than the actual number of people tested. So in the Isle of Man, is our test data, what are the number of people tested, and is there a big difference between the two?
In our data, the difference is very minimal because there's been very little double swabbing involved. So the numbers we are reporting in terms of tests is near enough exactly the number of individuals actually tested. I will be announcing changes to our testing system so that we will be doing regular testing of frontline workers in certain positions, and also we'll be doing some exploratory work within nursing homes as well. So that will change because that will then mean there's tests being done on multiple people. But the figure we have so far to date, other than a few double tests, it is pretty accurate to the number of individuals that have actually been tested.
The discrepancy, there's some days there's one person tested, but there's 60, 70 people, 60 tests. Is that key workers maybe coming in, or
no? So what people are referred from various routes. So for instance, one of the things we're doing when you see people referred in, that's the ones who've been through the 111. But don't forget, we're testing all admissions to hospital as well. So they included in the data. So that's where there is the discrepancy because the people are referred from multiple areas. We do some testing in the community as well. So for instance, if we had somewhere where there was a lot of vulnerable people, we would test people around them. So that's where, so not everything goes through the 111 line, and that's where the number comes in. But the number of tests referred in is the number, pretty much the number of individuals being tested that day.
Thank you. Thank you.
And last but certainly not least, we started with you, Frank, so we should finish with Frank. Frank, your final question for the Minister, please.
Yes, now that we move towards, it's a two-part question. Now that we move towards more of a normality again, if you want to call it that, I noticed there are changes in the way that people behave For example, I tried to buy a bike the other day, and it's very hard because everyone's rushing to buy bikes now. Presumably, A, because they want to stay fit, but B, also they don't want to take the bus, so they can't share cars anymore into town, those kind of things. So there's this talk about the new normal that we will have to get used to. My question is, first part, is the government already working on a manual for this new normal, which we may have to live with in the next 6 months, 12 months, when we get back to this new normal? And the second part is, where does the government itself look for guidance and for how to do things right in the world? Do you look at like Iceland or New Zealand or other countries? Do you communicate maybe with them to exchange best policies on how to do things right? This can't be an easy job to get the right guidance on this.
If I take the second part first, actually, yes, we do. We look at evidence from all around the world. Obviously, our outbreak and first cases of COVID-19 emerged later than a lot of other jurisdictions. So we were in the position as well to be able to see what was happening elsewhere and be able to plan for that. And also, we've been able to use evidence of how people are working to unlock things. Now, we're not just going to pick up policies from elsewhere and dump them here in the Isle of Man. It's very important we have Manx solutions to these issues, and we do it in a bespoke manner, but we do look at best evidence as to what is happening around the world, and we do engage. We don't just look to the UK and don't just engage with the UK, we engage much further afield in terms of what they're doing. In terms of the new normal, it's a phrase well trodden, but nobody knows with the crystal ball gazing exactly what that new normal will be. So what we have done as government is we have come up with the medium term strategy, and the key word in there is the medium term, that shows our direction of travel and where we are going and where we want to get to, and from there we would then look to develop a longer term strategy. I think there's several things that will come out of this that actually will stay with us for a long time and probably be of benefit. So, for instance, if I focus just on the department I'm Minister of, DHSC, we've struggled for many years around video conferencing, getting that in place, video consultations. It's all there now. We've set it up. So that's something we would want to look to keep. Equally, the 111 line has proved to be a great innovation for us. So there's elements of that we'd want to keep. But in terms of society as well, you mentioned there about people cycling like never before. That may well be something that people continue after this. They may not. Everyone might go back to their cars as soon as everything's back to normal and decide, right, I'm not cycling anymore, I'm driving. But I think there's a lot of social changes that will, for the good, that will come of this as well when we look back in many years to come.
I hope so. Thank you.
Thanks, Frank.
And thank you, all of you, to Frank and Paul in Douglas, Charles in Colby, Caroline in Sulby. Thanks very much indeed for all your questions. Much appreciated. Just one final question, if I may, for the Minister, and that is what I think we're week 9 of lockdown is just concluding as we record this. So in that regard, is there anything major that you feel strongly about that government perhaps would have done or acted upon differently thus far?
Well, thank you for the curveball question at the end, James. To get my own back, I will just pull you up on one thing. We're not still in lockdown. I need to make that abundantly clear. Lockdown has, what we do would term lockdown is ended, and we, to use political jargon, we're in what we would term now our stay safe phase. In relation to government's response, I think overall we have had a very, very good response. I think if there was one thing I would change, it would probably be the way we engaged with the public initially. I think the press conferences and the way we're doing them now is working very well in getting the direct message out. I think maybe those initial press conferences didn't work quite as well with the format. So I think that's something that we would change. But I think overall, I must say the response has been very good. But the reason government's response has been able to be so good is down to the Manx public, basically, to the Manx public listening to the messages, actually doing the responsible thing for our island, our community, and themselves and their families. And that is why we've achieved it. Without the support of the Manx public in doing that, we wouldn't be where we are now. So actually, as Minister, it's me that should be saying a big thank you to everyone for all that they have done as part of this, because they are what has made the difference.
And thank you, Minister, as well for mentioning that. And also, I think it was to the point up until fairly recently where the humans were almost looking forward to the walks more than our four-legged friends were as well. Thank you, Minister, for joining us, and thank all of you who have taken part both on Zoom and also by submitting some questions to us this afternoon. To those who didn't get your questions asked today, we will try and get as many different people as possible heard, and we'll hope to open up the floor virtually again to you in the next week or so. Please keep them coming in. There is an address. It is an email address. It is COVID-19 community support at gov.im. COVID-19 community support at gov.im. Thank you very much for your company. Very good afternoon.